Do you get totally confused standing in front of the over-the-counter product section in the pharmacy area? Over-the-counter products look complicated on purpose because there are billions of dollars to be made on over-the-counter products and everybody wants a piece of the pie. But the secret is that there's only a few main ingredients in all these products and they're just put together in different ways. And there's only those few. There's not a lot of stuff. I'm gonna clear up the mess so you can stop feeling overwhelmed and you start feeling confident about your choices. So, welcome back to Nutrition Prescription, where every week we dive into how nutrition, movement, and everyday choices shape your health without always relying on a prescription bottle. But today, I'm taking a particular detour. I'm Dr. Steve Hewlett. I've been a doctor of pharmacy for 35 years now. And today we're going to be talking about over-the-counter product or all the over-the-counter medications. And these are the ones that are in most of your cabinets. And these are the ones I want to teach you how to pick them. I want to teach you about some of the side effects, the interactions, and the smart ways to use this. Just little tips that you can find out without having to confuse you with all these medication names. So we're going to look at how you can do this safely and be informed of what you're doing and why you're doing it. Today, the whole thing is about taking care of your body. That's what this is all about. Whenever you have to go in and you have to take medications, it's usually because there's something that your body is telling you. And that's what you really need to think about. So what we're going to be talking about today, we're going to be talking about pain, eyes, your respiratory tract, and your gastrointestinal tract. Because when you think about it, that's really what we're doing. Our skin keeps the inside of our bodies separated from the outside of our bodies. All the chemicals, all the things, all the pollutants and everything that are in our air and everything outside of our body, our skin keeps us protected. So you have to be thinking when you start feeling bad about something like this, it's because there's something that's on the outside that's getting on the inside. So when you think about that, think about where it is, like around your head. Things can get in your eyes, they can get in your ears, they can get your nose, and they can get in your mouth. That's the way bacteria and viruses are all going to get. That's how they're going to get into your body. But then you're also going to have ways that bacteria can get into the other orifices in your body also, like your rectum and also in your private area. So there's all kinds of ways that bacteria and viruses and pollutants and toxins can get inside your body. So when this happens, your body wants to set up an immune response to try to get rid of whatever that is invading your body. And that's why we have these symptoms. So I'm going to break each one of these down. We're going to be talking about pain, the eyes, the respiratory tract. We're going to break that up. You have the upper respiratory tract, and that's your nose, your mouth, and your throat. So that's all your upper respiratory tract. That's where you're breathing. And then the lower respiratory tract, that's going to be your bronchial tubes and your lungs. So remember, when you breathe in through the nose or when you breathe in through the mouth, that's one tube that comes in. It comes in your nose and your mouth, goes down, and then it splits and goes into your lungs. However, there's also the gastrointestinal tract. There's the upper GI tract, gastrointestinal, and lower. And gastrointestinal, gastro means stomach, and intestinal means that. It's the intestines. So again, just like with the respiratory, you had an upper and a lower, same thing with your GI tract. Because your mouth and your throat, all the way down your esophagus and your stomach, that's your upper GI tract. And then it goes down into your intestines. The food goes from your mouth down in your stomach and into the intestines, all through your small intestine, and it gets in your large intestine at the bottom. And that just goes up your right side, over across the middle of your abdomen, down, and then out through your rectum. So just that's just basic physiology, just to know what you're talking about. So remember, when we talk about this respiratory, you breathe, your respiratory tract and your GI tract both have the mouth and the throat involved. But right below the throat, that's where you're going to have a little bifurcation where one tube goes into your lungs, and that's going to be your bronchial tubes. And your other tube goes down, that's the esophagus, that goes down to the stomach. And right where those bifurcate, okay, right where one goes in the lungs and one goes out, that's called the glottis. And on top of the glottis, there's a little epiglottis, that's just a little bitty flap. So normally that flap is covering your esophagus, and so you can breathe all day long. You can keep breathing. But once you swallow, that causes called peristalsis, a thing that propels food through your GI tract. When you swallow, that causes that epiglottis to open up, allow the food to go down into your stomach, and then it closes again to allow you to breathe back and forth. Think about that. So it's kind of like a fork a fork in a river, or think of a train track, maybe a switch in a train track where the trains are all going to be going one way. And then all of a sudden you have to switch the track so the one train can go on and then switch it back so the other trains can go along. It's the same kind of thought process. So anyway, I didn't want that to confuse you. I just want you to understand that's what we're going to be talking about. So first thing we talked about is pain. Remember, pain is extremely important for you to have. There are conditions where people do not sense pain, and these are horrible situations. And just as an example, think about diabetics. These diabetics who have nerve damage. And so in their feet, they have nerve damage and they can't even feel their feet. And a lot of these people are obese and can't even bend over and look at the bottom of their feet. So this is why a lot of diabetic patients end up coming to the hospital. They get up on the table and you take their shoes off and the bottom of their foot is so rotted, you can see the bones. It's the huge ulcers. And this is usually why diabetics have to lose their feet or their legs, because they don't feel the pain. They don't know that there's a sore there, so they don't know how to baby it. Now think about it. If you're normal and you get a pain in the bottom of your foot, you're not going to step on it. You're going to be using your other foot more. You may be using your toes or a different part of your foot. You're going to baby it. And that's on purpose. That's what you're supposed to be doing. Baby that. Don't make it worse. Let your body get in there and take care of that. Because if you don't realize there's pain, if you don't have pain, you don't realize it, and it just keeps getting worse and worse. So yes, you don't want a lot of pain, but you do want a little bit of pain to let you know that there's still something going on, because the whole thing is when you have symptoms, your body is talking to you. So you've got to listen. What are they trying to say? So as far as the pain, there's two different things you want. As far as over-the-counter products, there are some things that are called non-steroidal anti-inflammatories. So if you've ever had any kind of serious pain that you've had to go to the doctor for, or a serious allergic reaction, and they'll give you a steroid like a Medrol dose pack. And that's a steroid, because steroids can help with inflammation. So that's why those are steroids. The prednisone and the Medrol dose packs and all that you get, those are steroids. The non-steroidal anti-inflammatories are the things that also treat inflammation, but it's not a steroid. So those are going to be your things like ibuprofen, naproxen, and aspirin. Okay. The way I'm going to go through this, I'm not going to sit here and tell you about a bunch of drug names that you have to remember. What I'm going to tell you is, like I said, all they're pretty much, they're just a few different ingredients. Just like I said with pain, over the counter, if you're getting something for pain, it's either going to be ibuprofen, naproxen, or aspirin. Pretty much that's the main three. Okay. But they're going to put them in all these different products. So the way that you can tell is go to a product that only has one ingredient, like Advil or Motrin, something that you know, and it says it's for pain. On all these products, they have a little area. It's called the active ingredients. And that's what you want to know. So you take the product off the shelf, look on the back for where it says active ingredients, and see what that says. So if you know that this product is only for pain, when you turn it around, you're going to see what it has, whether it has ibuprofen or naproxen or aspirin, it'll be on there. And that's a good way for you to know. If you go pick up another product and look at the active ingredients, and that may have 3 different ingredients, but one of them is ibuprofen or naproxen or aspirin, you're going to know that's the one for pain also. That's the other thing I want you to realize, is that really you'd rather not have combination products. You don't want products that have all these different ingredients in it. Something for pain, something for runny nose, something for a cough, something for chest congestion, because all of these medications have different adverse effects. So as long as you know what med is being used for what condition, then you can just single out. That's what we do. In my house, we don't have any combination products. We just know, oh, we have a runny nose, I'm going to use this. We have a congested nose, I'm going to use this. I have pain, I'm going to use this. So it's always best to just narrow it down to the symptoms that you have, if you can. So back to pain. As far as pain, there's going to be some pain that has inflammation involved with it. If you have an earache, if you have a sore throat, if a baby's cutting teeth, anything like that, there's an inflammatory aspect to it. So that's when you're going to want to use an anti-inflammatory. So that a non-steroidal anti-inflammatory. So that's something like the ibuprofen, which is Motrin or Advil, naproxen, which is naproxen or Aleve, and then aspirin they put in all kinds of products. The main thing with these anti-inflammatories is that they tend to have more adverse effects, because the other one that people tend to take for pain is acetaminophen, which is the main ingredient in Tylenol. Now, acetaminophen, Tylenol, is not an anti-inflammatory. Tylenol works in the brain. It just makes it where you don't perceive the pain. So it's not doing anything for the actual whatever the soreness is. It's just making it where you don't perceive it. And like I said earlier, that could be good and that could be bad, because you need to be observing some of your pain so you know that there's still something wrong in your body that you need to take care of. So Tylenol only works centrally, so you don't realize that you have pain. The anti-inflammatories like ibuprofen, naproxen, and aspirin, those work centrally just like Tylenol. It works the same way where you don't perceive the pain, but there's also an anti-inflammatory aspect. So it actually decreases the inflammatory process that's going on. So if you have something that's really overinflamed, then you might want to take one of those also to get rid of the inflammation. Or if the pain, like I said, from an earache or toothache or sore throat, something where it's raw, something where there's inflammation, that's where a non-steroidal anti-inflammatory may do better than Tylenol. If you can get by with Tylenol, that's better, because Tylenol, of all the medications out there, Tylenol is probably the safest medication to be on. There's only 4 different adverse effects, and those are not major adverse effects. However, all the other medications do have a lot. The only reason Tylenol or acetaminophen gets a bad rap is because they put acetaminophen in everything, because it has such little side effects and it's good for pain. But since it is in all these things, it's very easy to overdose. So that's another big reason why you need to be listening to this. And when you look at products, look at all your products, look at the active ingredient list. And if you have 2 different products and they both say acetaminophen, then you need to put one back. And that's another reason why it's better not to have a bunch of combination products, because they're going to put these in all kinds of different combinations. But as far as the adverse effects with the NSAIDs, the main thing is they can decrease your body's ability to bleed or to clot. It can actually cause more bleeding. And this is a problem, because if you take these NSAIDs all the time, you're tearing your body up, and you're also not listening to your body. Because if you have to take these all the time, there's something underlining it. Just like all the prescription medications, most of the prescription medications, all they're doing is treating symptoms. They're not taking care of the underlying problem. And the underlying problem with a lot of this stuff goes back to our nutrition and the putting nutrients in our bodies instead of the toxins in our bodies. NSAIDs can increase your chance of bleeding. They can also affect your kidneys. They can start causing kidney damage if you're taking these all the time. And they can cause severe stomach upset also because of the way they work. If you take very much of these NSAIDs, it actually causes so much stomach irritation that can actually cause ulcers. So now you can have an ulcer that starts bleeding, and NSAIDs also decrease your body's ability to clot. So if you get a bleeding ulcer and you're taking one of these NSAIDs, ibuprofen, naproxen, or aspirin, you're making the ulcer worse and you're making the bleeding worse. So there are severe adverse effects to these. If you take them just every now and then, that's fine. But I know there are people who take these things every single day, and that is horrible for your GI tract. So as far as pain, you have to decide, is it inflammatory or is it just a general pain like a headache? Although headaches can be caused from inflammation as well. So that's pretty much it on pain. Just be careful and look at your active ingredients. And again, that's going to be the same thing I want to say with all these things, is look at your active ingredients. So the next thing is the eyes. This is the next way where things on the outside can start irritating your body. So you can get bacteria, you can get chemicals in your eyes, you get all kinds of allergens in your eyes. The most important thing to realize with eye medications is look at the expiration on these. Go through your medicine cabinet. I highly recommend you going through your medicine cabinet now, because you're listening to this and it's on your mind. Go through your medicine cabinet and check the expirations on everything you have and get rid of everything that's expired. Now, some things still last for a while after their expiration, and that's true. Do not do that with eye meds, because eye meds going right in your eye, and your eye has a special pH balance to make sure that anything goes in the eye, it doesn't cause irritation. As these medications sit around past their expiration date, then that can make it to where it's not going to be adjusted to your eye, and you can put it in your eye and your eyes are going to burn. Okay. It's going to irritate it. So that's a number one thing. If you're talking about eye medications, always check the expiration and go through your medication cabinet now and throw away everything that's expired. But when we talk about eye, the main thing we talk about is red eyes, watery or itchy eyes, or dry eyes. So red eye, remember all these things, the reason your eyes are red, watery, itchy, the reason why that's happening is because you've got an irritation in your eyes and your eyes are trying to get rid of it. And that's what it does. So it releases what's called histamine. Histamine makes your blood vessels dilate. They get bigger. So that's why you get the red eyes, because it's trying to increase the blood flow to your eyes so it can get all the white blood cells and all the things that are trying to take care of whatever the irritation is, and then it'll go away. Your body's trying to help you. Same thing with watery, itchy eyes. If you have something in your eyes, your body wants to help you get rid of it. So it starts producing tears and get your eyes all wet. So those tears can clean your eye out and it can and drain that on out, either through your lacrimal ducts or it's going to be coming out through the corner of your eyes. They're watery, they're itchy because they're irritated and your body is trying to get rid of that irritation. The dryness comes from a lot of different things. A lot of times dry eyes are because you're dehydrated and you're not drinking enough. But there's other things that cause dry eyes also, just the environment in general. If you get something in your eye, think of the things that you're going to do for dry eyes as a lubricant, like putting oil in your car. You don't want metal sitting there grinding on each other. It's going to tear up. So you put oil in there so it decreases that friction. Same thing when you have dry eyes, then you want to put an oil in there. So as you blink, then you're not just rubbing over your dry eyes and causing abrasions to your cornea. What you want to do is have like oil in there so it keeps it lubed. And that's why you do a lubricant. So if you have red eyes and you want to get rid of it, you want to put something in there that causes the blood vessels to constrict down. Like think of Visine. Okay, that's one that you can use and that'll constrict those blood vessels down so they don't look red anymore. But remember, they were red for a reason. They're trying to tell you there's some kind of irritant in there. So if they keep getting red, then you need to figure out what that irritant is. With itchy eyes, if again, that's trying to clear your eyes out, but if it's watery too much, that's when you take, remember, histamine is what your body releases. Histamine, it's called SLUD. Histamine, anything for salivation, lacrimation, urination, defecation. Okay. Those are the things, those are your cholinergic things. So salivation, that's going to make you water your mouth, lacrimation, teary eyes, watery eyes. And then you already know what urination and defecation is. So when you take an antihistamine, okay, that's going to do the opposite of that. So instead of having watery eyes, it's going to dry your eyes out. Instead of having, again, and the itchy eyes, it's going to take care of the itchy eyes as well. And the same thing is that when you take antihistamines, that's why a lot of times you're going to get dry mouth, because it's drying your mouth up. It's drying all the things that your body is trying to produce to get things out of there. Redness, you're going to use something called vasoconstriction. Watery, itchy eyes, you're going to use an antihistamine. And then if they're dry, you want to look on the eye products that says this for dry eyes. That's all you want is dry eyes. And then look at the active ingredient. When you pick a product and look at the active ingredient, if there's more than one or two or three ingredient, or more than two or three ingredients, again, you might want to stay away from that because of all the adverse effects. But if it only says for, say, redness, you turn around, there's only one ingredient. Now you know that any other product for your eyes that has that ingredient, that's going to be the one that helps take care of the redness. Same thing with the watery, itchy eyes. The antihistamines are going to be your more expensive ones. These, when you go to your eye products, these are going to be the ones more expensive. These are the antihistamines. These are for the watery eyes, the itchy eyes, all the allergies. But again, look at the active ingredients, look at what it is. So when you see these other products that have multiple ingredients, you'll know which one is for the watery, itchy eyes. And again, for the lubricant, these are going to be like your natural tears. There's going to be mineral oil or polyvinyl chloride. And there's different ones that are actually for dry eyes. And that's what it is, like a mineral oil or petrolatum, like Vaseline. They have some of that in there. This is just going to lube your eyes and just make them a little bit where you can close them easier. Okay, so the main thing with the eyes is look for the expiration. Okay, and for all these, look at the active ingredients. So if you're ready to stop feeling stuck and you're on too many medications, you're frustrated with your weight, you can also click the link in the show notes below and book a one-on-one call with me. We can go over your medications. We can go over your lab work. We can go over your history, your habits. We can go over your goals. And the whole thing is try to get you on fewer medications to lose weight, and to feel like you're more in control with your life. So if you want one-on-one help, just click on the show notes and we'll get in contact with each other and we can go over whatever questions you may have about that. So now we've talked about the eyes, talked about the nose. Okay. Now let's talk about the upper respiratory tract. Okay. Your upper respiratory tract, like I said, the upper respiratory, that's going to be stopping right at where you have that bifurcation, where it goes from where you have the glottis and the epiglottis, where one part of the fork goes down the esophagus down to your stomach, and the other part of the fork is your bronchial tube, goes to your lungs. So from your throat up, that's called your upper respiratory tract. And this is very important because you kind of think of when you have a cold, think of it like a progress. Okay. If all of a sudden you have a runny nose and you decide you don't want to take care of that runny nose and you just keep letting it run and run and you keep blowing it, then you lay down at night and now you have that runny nose, and instead of running out, it starts running down the back of your throat. While it's running down the back of your throat, it's going to start causing irritation and you're going to start coughing in the middle of the night. So you're going to cough and cough. The more you cough, the more raw your throat starts getting. And once your throat starts getting raw, now you can have different bacteria and viruses and things settle in there and start causing infection. So now you cough more. Now you have bacteria in there, and now it can actually drip down into your lower respiratory tract, which is in your lungs. Now this can go into things like bronchitis and pneumonia. So if you stop that right at the beginning, as soon as you get a runny nose, you stop that, you may be able to prevent all this other stuff from happening after that. You know that I'm all about nutrition and not using medications that treat symptoms. However, these over-the-counter products that treat symptoms, little bitty symptoms that you can take care of right away, the sooner you can get that taken care of, hopefully that's going to make it better where it's not going to be progressing to these worse things. So the first thing is sneezing. When you're talking about the upper respiratory tract, you're going to clear out your nose and you're going to have a runny nose or dry nose. Okay, that's what we're talking about. So sneezing means that you've gotten something up in your nasal passages that's irritating. So when you sneeze, you're trying to blow that, whatever that irritant is, you're trying to blow that out your nose. So you really shouldn't be trying to stop a sneeze. And I know sometimes when you're out in public, you may be afraid to sneeze because you don't want the loud noise or whatever. But still, remember, you're sneezing because your body's trying to get something out of your nose to keep it from getting lower down into your lungs and causing more infection. Same thing with the runny nose. The reason you have a runny nose, your body releases histamine, so it produces this mucus, because what happens is as you inhale things in through your nose, you have all this mucus and all this dust and particles and allergens, they get stuck in that mucus. And then you have little hairs that cause irritation, and that's what allows you to sneeze or cough up, all this mucus. But it's there for a reason. It's trying to protect you from getting these allergens and everything back down into your lungs. It's your upper respiratory tract is trying to keep you from getting an infected lower respiratory tract. So runny nose, okay, that's you getting rid of it. And again, just because it's histamine that causes it, so taking antihistamines, something like Benadryl, okay, you can take, there are some things you can take by mouth and some things you can take topically. Anything you squirt in the nose, that's topically. The reason that's important is because when you take something by mouth, that goes in your mouth, in your stomach, in your intestines, absorbed in your blood, and it affects everything all around your body. To where when you do something like just a nasal spray, that's more topical. It's just staying right there in your nose. It's not affecting the rest of your body. So antihistamines like Benadryl or chlorpheniramine, these things, what they do is they can cause a lot of drowsiness. And some people that can really knock them out. So you have to be careful with that. So realize that is one of the cases. So you can stop a runny nose orally by taking Benadryl, but again, that's going to affect your whole body and your brain. Or you can do it topically, like with a nasal steroid, like Nasacort or Flonase. And these are steroids that are going to help stop that mucus production that you have in your nose. And again, remember, you're having mucus production because there's something in your nose that your body's trying to get rid of it. But that's the difference between taking a nasal spray or something oral, because oral is going to affect your whole body. The sprays are going to affect just locally. So what I recommend is if you have a runny nose, you can take the Benadryl at night because it's going to make you sleep, and maybe that'll help you sleep. But during the day, If it makes you tired, you may want to do something just like one of these steroids, like Nasacort or Flonase, one of those that you're going to want to put in your nose for during the day. The other thing is a neti pot. There's some people do neti pots. I've never done it, but I know a lot of people do, and they love it. Where you just go to the store and they have them, and you just basically you push water up one nasal passage, and it pushes it out the other way, and it clears all the mucus out. So that's another thing you can do that doesn't affect all over the body. So that's with runny nose. Runny nose is there for a purpose. You can treat it topically, or you can treat it with oral route with the antihistamines like Benadryl. The other one is a dry nose. If you have a dry nose, the most common reason for dry nose, one is dehydration, but other is because like in the winter, you've got everybody turns their heat. It's cold outside, so all the precipitation is freezing and dropping to the ground. So there's no humidity out there. When you're inside, you have your heaters on because of being cold outside. The heat on the inside, it dries and evaporates all the moisture. So you're not getting any moisture inside or out, and so you're not inhaling that. So what you want to do is, first thing, again, make sure you have plenty of fluid on board, but you can also get a humidifier. Those are huge for helping your body from not being able to start getting infected and everything, because your nose is so dry that it starts breaking up, starts bleeding, and bacteria and viruses can start setting in. So you can either do it with humidifier. You can even boil water on the stove. Just be careful if you have kids, obviously, that they aren't around the boiled water. But you can put a big pot of water on the stove and just boil it and let that steam go out into the air. That'll even help. And then you can also do just regular flushes, saline flushes. They have things like Ocean nasal spray, things like that over the counter. And that's just a saline spray. And what that does is you're basically putting salt water in your nose, and that salt pulls the fluid out of your blood vessels into your nose. So it makes your nose more lubricated. It makes it feel a lot better. And again, very little adverse effects. But using the Ocean nasal spray, using these saline sprays, there's really not a whole lot of adverse effects with those. So dry nose, humidifier, boil water, put saline spray up the nose, anything like that. Make sure you're drinking plenty of fluid. Now, nasal congestion, this is important because this is when your blood vessel, you have little turbinates up in the top part of your blood of your nose. And when those get all swollen, then you can't breathe. You're sitting there and trying to breathe, but the blood vessels up in your nose are so swollen that air can't get past that. And so that's why you want to make sure that's not what's going on. So what you want to do is put something in that makes that blood vessel constrict down. Once those blood vessels in the turbinates up in your nose constrict down, now you open up the path so you can start breathing again. That's all well and good, but you have to be very careful, because the products that they have, like Afrin, when you use that, and it's for nasal decongestant. Nasal decongestant means you're trying to decrease those blood vessels up there in the top of the nose. When you have this nasal decongestant, it makes the blood vessels constrict down so you can breathe better. But if you take an oral decongestant, nasal decongestant like Sudafed, remember, when you take it orally, it's affecting all over your body. So it's making blood vessels all over your body constrict down. That's why if you are on high blood pressure medication, you don't want to be taking an oral nasal decongestant, because they work by causing blood vessels constrict down. And if you already have high blood pressure, you don't want to constrict those blood vessels down like that, because it's going to make your pressure worse. So that's why nasal decongestants are not supposed to be used when you are taking blood pressure medications. Okay. So if you are, then you need to go to the topical route. And that's when you can use the Afrin, or again, you can use the Nasacort or the Flonase. That can help with a decongestant as well. The only problem with the Afrin, again, that's topical. So you can take that even if you have blood pressure issues, because it's mainly topical, depending on how bad your blood pressure is, because some can still get into the blood. But the problem with this is if you keep using this, if you use this more than twice a day for more than 3 days in a row, you actually got what's called rebound congestion. So it works for a little while, but after about 3 days, now all of a sudden you're making your nose more congested. And so you keep having to use this Afrin because your nose keeps getting congested. So that's why anytime you're on Afrin, you never use it more than twice a day. And you definitely don't want to use that if you use it twice a day. And then you definitely don't want to use it more than 3 days in a row. Okay, does that make sense? So you need to make sure to use that very strictly. So nasal congestion, you got to be careful with it. Think about, do you have blood pressure issues or do you not? And then also remember to only use it for 3 days. Then the lower respiratory tract, Okay, now we're getting into lower, we're getting down the lungs. So again, when you get stuff in your lungs, there's only one way for your body to get that out of your lungs, okay? And that's to help you cough. So you are trying to cough because you have mucus down your lungs, and that's the only way to get it out. So if your body is coughing and it's from your chest, you're trying to get that out, you do not want to stop that cough. That's the only way to get that up and out of there. So cough through the day, but if coughing is keeping you awake at night, that's when you want to stop it. And of all the products out there, there's only one thing for cough, and that's dextromethorphan. So anything that says DM, Robitussin DM, Mucinex DM, anything that says DM, that's dextromethorphan, and that's the only ingredient over the counter for cough. So all the products that say they take cough, when you turn it around, you're going to see dextromethorphan, and that's the cough suppressant. As far as the upper GI and the gastrointestinal tract, we have totally torn our gastrointestinal tracts to pieces with our diet, with all the man-made food, which is nothing but glucose, fructose, seed oils, and chemicals. And all that stuff is very toxic to our GI tract. So I'm not going to go deep into the GI tract because I gave 2 whole podcasts back to back on this. Podcast number 128 was Gut Matters, the ins and outs of digestive health. And podcast 129, how does an unhealthy gut lead to an unhealthy body? So there's so much to do with that. So I won't even talk about that if you want to go back and listen to that. But basically, it's the same thing. If you have gut issues, like you're having reflux, you're having heartburn, that is a nutrition issue. Almost 100% of the time, that is all because of the nutrition that you eat. And you go back and listen to those podcasts to explain that. Now, I did miss the sore throat. A throat is also, again, that's part of the respiratory tract, but it's also part of the digestive tract because both air and food goes down through that area. And this is why, because of that epiglottis, that's why you don't want to be talking or laughing when you're eating, because that's when you're going to mess up your epiglottis. And instead of the food going in your esophagus, it switches and goes down the other tube, and that gets into your lungs. So that's why you have to be careful, and you should be eating. You should be very relaxed and not talking while you eat. But as far as sore throats, again, a lot of it, if it's cause of inflammation, which a lot of time it is, you can still use your non-steroidal anti-inflammatories that we talked about. But you can also, before you even do that, you can even try drinking something hot water, hot tea, hot coffee, unsweet on both those, gargling salt water, and just resting. All those can help with the sore throat. Okay. Warm things on there, salt water. Salt water helps, just like it did with the nose. It helps pull fluid in that area, and it makes it to where it's a little bit more moist. So now we're down in the stomach. The stomach, again, people have heartburn, they have reflux. Those are major issues. So go listen to podcast 128 or 129. The other thing is, if you have stomach issues and there's a lot of pain, like a sharp stabbing knife, that's usually gas. And so that's the only ingredient in all those products. If it says it's for gas, it has simethicone in it. That's the only ingredient is simethicone. And simethicone, what it does is it coats these big bubbles and it pops them into a bunch of little bitty bubbles. So this big bubble in your belly, or if the gas gets down into your intestines, it's going to cause pain all the way through there also. So what you're trying to do is break that great big bubble, break it down to a lot of little ones. So again, when you break it into little ones, you're going to be doing stuff like belching, farting, anything like this. You're going to be getting those little bubbles up and out of there, but that's going to make it where it doesn't hurt as bad. So that's where belching and burping comes in. That's because you have air in the stomach. And usually when you get air in the stomach, it's because you've been drinking through straws, drinking carbonated water, talking a lot while you're eating, crying. If a baby's crying a lot before they eat, and then even laughing while you eat. All those things put air into your stomach that can cause the belching and the burping as air in your stomach. And then also it can cause severe pain, like those like shooting, stabbing pains. And that's going to be the big gas bubbles. And that's where simethicone comes in. So if you're having a lot of trouble with belching and burping, watch what you're doing. You might want to not talk as much when you eat or laugh. Stay away from carbonated beverages. Stay away from tight clothing. Don't drink through a straw as much, because straws also make you inhale more air. And now the last part we're going to get to, this is the lower GI tract. And again, the lower GI tract, that's going to be pretty much from the middle of your small intestines all the way down through your rectum. That's the lower GI. Upper GI is your mouth, your throat, your stomach, and the first part of your small intestines. So again, gas, that can be anywhere through your GI tract. And again, it's going to be simethicone that's going to take care of it. If it's down lower in your intestinal tract, it may take a little bit longer for the simethicone to get down there, but eventually it will get down there. The other big things are constipation and diarrhea. Constipation, one of the major reasons people have constipation is not because they're fiber depleted. It's because they're dehydrated. They don't drink enough water. Most people drink things that actually make you pee more, which goes against being hydrated. They make you dehydrated. Things like anything with caffeine in it, anything with sugar in it, and anything with alcohol in it. Those three things, and those three things tend to be what most people drink all the time. So people are walking around dehydrated. That is a number one reason why there's constipation. Okay. Plus, we've torn our GI tracts up so bad with all these chemicals and everything, man-made food that we're eating. That caused a lot of it also. But one way, if you're constipated, one, drink plenty of water. Two, you can even put electrolytes in your water. Put sodium, potassium. They have different electrolytes. Even if you just want to put a teaspoon of sodium, salt in there in your first bottle, make sure it's in a big bottle. It really doesn't taste that salty. I don't really care for the taste of salt, but I know salt is extremely important for us, so we have salt all the time. What these electrolytes do is, just like I said with the nose, it pulls fluid into that area. So it pulls fluid into the bowel, and that helps with the constipation. You can also, if you eat a lot of fruits and vegetables, and definitely if you eat a lot of man-made food, there's no fiber in man-made food. And if you're drinking these fruits and vegetables, you're not getting any fiber either. So if you have a lot of plant-based foods, you need fiber. And fiber does the same thing. It keeps all that food in the intestinal tract, and it helps bulk it up. It helps pull fluid into the area so it can pass on through. If you're mainly eat animal-based products, then fiber isn't that big a deal because you're already eating all the kind of stuff that stays in your GI tract anyway. So this is mainly if you eat a lot of fruits and vegetables, and if you eat a lot of man-made food, you really need to make sure you have plenty of fiber in there also. So as far as medications, there's different ones that you can take. There's things like Metamucil, same thing. It's a bulking agent. Things like this, they just pull fluid into the bowel. And this can be good or bad, because if you take Metamucil and you don't drink enough water with it, then it's going to sit there in your intestine. It's going to solidify up like concrete because you don't have enough water to pull in. So you need to drink water with it, and you need to stay hydrated if you're using some of these, because if they get in your bowels and you're not hydrated and you don't drink with enough water, it's going to be concrete in your intestines. There's another product you can use for constipation called Colace or docusate sodium. This is a softener. What Colace does is it coats the stool and pulls water into the stool to make it soften up, because a lot of times, because of dehydration, your stools are so dehydrated that they just stop. So being able to coat that with this Colace, so anything that says it's a stool softener, that's going to be docusate sodium. And that's what a stool softener does. Coats the stool, pulls fluid in, so it makes it more moist. Then you actually have laxatives. And you've got to be very careful with the laxatives, because laxatives do just that. You may have this solid rock in your stomach because you're so dehydrated and you're eating bad foods, doesn't have any fiber in it, and you have this rock, and now you go and you stimulate your bowel because you're constipated. So now you're just pushing this rock all the way through your intestines. So you don't necessarily want to be using laxatives until you try all these other things. And water and electrolytes are key number one. First, try water, and definitely try putting a teaspoon of salt in there, and you'd be amazed at how much it's going to help you get that out of there. Be leery of the laxatives, but you can if you have to. But again, make sure there's water and electrolytes in there first. Now there's also diarrhea. Diarrhea is another thing. Diarrhea usually comes from the colon. That's the most common reason why. Because the whole function of the colon, your lower intestines, is when the food gets through there, it has water that's carrying all through your intestines. And now once it gets in the colon, you want to pull that water back out. So the colon pulls out. So if you irritate your colon, have some kind of colitis, anything like that, some kind of bacteria that's gotten in your colon, it doesn't work right. And so it doesn't reabsorb the water, and the water is going to stay there, and you're going to have a lot of stools. So that's one thing. Diarrhea is frequency of stools. That doesn't mean watery stool. Watery stool is a watery stool. Diarrhea is frequency of stools. But usually when you have watery stools, you're also having a lot of frequency of stools for the same reason, because your intestines aren't able to absorb the water back up. So when you have a lot of diarrhea, the main thing people do that are incorrect is they say, oh, every time I drink something, I'm pooping it out, so I'm going to quit drinking. That is wrong. That is change your thoughts. That is exact opposite. When you have diarrhea, the biggest problem with this is you're going to become dehydrated. And dehydration is what puts people in the hospital, especially babies. The smaller you are, the more this is going to put you in the hospital. So the first thing when you have diarrhea is you've got to be drinking lots of water and lots of electrolytes. So drink your water and put electrolytes in your bottle, your water bottle, maybe twice a day. But you've got to keep drinking because your body is getting rid of the fluid for one reason, because it's trying to get rid of whatever's causing irritation in the stomach or in the intestines. So that's how it does it. It's trying to get rid of all that bacteria that's accumulated in there. So you just have to make sure that you drink plenty of water to make up for what you're losing through that. And again, there are things like Imodium that you can take if you have diarrhea, but be careful with things like this. Because if you have diarrhea, it's because you've got a bacteria or something in your gut, probably, that you're trying to shed out. Your body's trying to shed. So if you take something to stop that, then actually you're keeping the bacteria in there and it could actually become worse. So yes, you don't want to become dehydrated. So even if you're trying to drink and you're still pooping too much or still dehydrated, then that's when you might want to try bulking up your stools. You can do that with Imodium. You can bulk up your stools with what we call in pediatrics, the brat diet: bananas, rice, applesauce, toast, anything that has a lot of fiber. Maybe that'll bulk up your stools as well. And the only other thing that we're going to talk about is bleeding with your intestines. If you see blood in your stool, okay, this is time to be worried. Now, there's two different things. You can look at the blood. If it's dark and tarry, that means that the blood is coming from your upper intestinal tract, GI tract, maybe around the stomach or your duodenum. If it's bright red, that means it's coming from lower, like down in the colon. If it's brown, that you need to be getting that checked out, because you could have an ulcer, you could have intestinitis, you could have all kinds of things that are causing this bleeding in the upper part of your intestines. In the lower part, if it's bright red, it depends on if you wipe and it's on your toilet paper, but it's not in the water, chances are that's more of a hemorrhoid. The inner lining of your rectum is bleeding and it's pushing out. So that would be a hemorrhoid. And that's something you would need to take something for the hemorrhoids to get rid of that. However, the other thing that you have to think about is if you have a lot of blood in the stool, then you could be having actually bleeding from the colon. And that's something you do not want to wait around with. You need to get a hold of the doctor and find out. It depends on how much blood is there as far as how quickly you need to get in, but you do need to get in and be seen to make sure there's nothing bad. So brown, that always needs to be taken care of. Now, if you take iron supplements, that can also cause dark, tarry stools as well. But if it's brown and it looks like blood, that's something up higher in the GI tract, get that taken care of. Lower, that's bright red, could be hemorrhoids or it could be something more serious. And that depends on how much blood there is. And if it's just on your toilet paper, if it's in the stool. I know this really went long, but I really think that this is important things for you to know. The main thing, if you want to just take anything out of it, is look for the ingredients. Whatever symptom you have, whether it's a stuffy nose, whether it's a runny nose, if it's gas, whatever, look for the product that says it treats, that has one ingredient. Look on the back and you'll know what that one ingredient does. Now, if you're looking at these other products that have multiple products, look at the active ingredients on those and make sure that you're not doubling up in any of these and you're actually only getting the ingredients that you need. So I hope that helped. It may cause more confusion. I'm sorry if it is. But again, if you are confused by any of this stuff or any of the medications you're taking, you can always click on the link below, get in touch with me, and we'll have a one-on-one conversation, and I'll try to explain everything that you need to know to get you going further on your way into your path of health. So for right now, until next time, thank you so much for listening. Stay nourished and stay well.